Greetings, this is Iris Heath. I'm a licensed clinical professional counselor, and I am coming to you on Mental Health Monday. Keep in mind, this is for informational purposes only. Today, I'd like to talk about depression. So, depression is a mood disorder, and I like to remind individuals who have clinical depression that there's a difference between clinical depression and feeling depressed. I like to present it that way. And so, individuals who have a diagnosis of major depressive disorder, it lasts for more than 2 weeks. It comes with a series of symptoms, including sadness, low mood, um, loss of concentration, eating too much or too little, and there are other things also. And it can be mild, can be moderate, or severe. And I like to remind individuals to please not use this information to diagnose either yourself or others, even after some years of training. And other individuals who do this also, it is actually something that we have tools to do, as well as from sitting with individuals, we have experience to do that. And it's not appropriate to use information to diagnose others. So I just like to leave that warning also. And it may be that individuals may be exhibiting certain symptoms, and yet it is better for them to go and seek out professional help so that they can receive the treatment they need. So, part of my reason for starting these YouTubes was that I really saw that we were dealing with a lot of loss and a lot of both depression and anxiety during this pandemic. And one of the things I wanted to do is to bring some hope to those who are dealing with these things, encouraging them to seek professional help, encouraging them to really, I call it tell on yourself, as well as to really not what we call self medicate, meaning taking substances, whether it's legal or illegal substances. Those things can also alter our moods, and it's just more beneficial to seek professional help, to find someone who you connect with who can actually help you through treatment. And so I've given you some of the symptoms. I also want to give you some resources. We have wonderful resources in the state of Maryland. We have some of the best hospitals. So we have some of the best treatment. We have research. So, and don't think these are the only places to seek out help, but we have some of the top hospitals in our state. So whether you're talking about a Shepherd Pratt, a Johns Hopkins, and again, there are others, and there are a lot of professionals who actually do this on their own, where they have their own practices. Keep in mind, whether they're licensed clinical professional counselors, whether they're licensed social workers, whether they work at a hospital, whether they work individually, whether your doctor may assist you and may be able to assist you with a referral, as well as your insurance company is a good place to look at. We also have support groups such as NAMI, NAMI.org. I will put some information in the description. And I'd like to also give you another symptom. Are you having any thoughts of suicide, of harming yourself? It can be difficult to talk about, and yet If that is the case, please reach out. Call 988 is a number that we currently have. If you can't remember that number, call 911. Let them know what your symptoms are: harm to self, harm to others. Those are things that require another level of help, another level of care. Please do not be ashamed or feel bad about that. It actually is treatable. Depression is treatable. And I like to remind clients that many things are treatable even if they're not curable, meaning with proper prescription and proper treatment, many things are treatable. And with that treatment, it is possible to feel better. It is possible to live the life that you'd like to live, to be able to do the things you'd like to do. Because again, depression can come with loss of interest in things that you like to do. It can come with isolating, although this pandemic has forced us into something I call a forced isolation. So if those are things that you are dealing with, some individuals deal with anger. And so my training says sometimes it comes that way. Grief of a loved one, and yet, or job, things, finances. These are possible symptoms. Again, I'm giving you this information not for you to diagnose yourself. So no self-diagnosing, no diagnosing your friends and family, but for you to take this information to your doctor. Let them know, I saw this lady. She brought up some things I've been dealing with. I wasn't sure if I should be concerned about them. I just want to talk to you about them. Let your doctor know. So I hope this has been helpful. It's not inclusive. It's just enough to ask you, if you are experiencing this, please consider talking to someone about it. Continue to keep up the good work, and continue to be and do well. Be encouraged.